Welcome back to my channel. This is the place if you are on your eczema healing journey and you're looking for tools, tips, and the science in healing eczema. I often talk about the gut, skin, and the nervous system and how all of the different systems of our body influence each other. I help you connect the dots to help you better understand your eczema journey and how to heal from it. And also on my show, I like to share life updates and also behind the scenes because I like to make the podcast fun. And healing is so much more than just the education and the knowledge. It's also personal experience, life experience, but you'll also hear a little bit about me as well. But today's episode, I actually want to jump right into it because there's going to be a lot to cover. I don't want this to be like an hour-long episode because it very much can be. I want to talk about food sensitivity testing, especially for people who are trying to heal from eczema, and why I don't actually recommend food sensitivity tests. So if you're on your eczema healing journey and you are thinking about doing the food sensitivity test, or maybe you've already done one and now you're on a very strict diet, this episode is going to be for you. We're going to cover what food sensitivity testing usually covers, the difference between IgE tests versus IgG, why IgG testing isn't typically recommended, especially as a dietitian and even allergy organizations. Of course, we're going to talk about diet and why some people actually feel really good from removing foods and others don't. Lastly, exactly what I do in my practice to help my patients navigate their food sensitivities, what is the process in reintroducing foods or navigating their diet. So first and foremost, I completely understand why people or you want to do testing. We think that when it comes to healing eczema, it's all about the tests that you do, getting as much info as possible, which of course is important. We want to have labs, we want to have blood work, we want to do GI map if possible to look deeper into what's going on in the body, especially if you've done a lot of things on your own without testing, you're not seeing any changes. Testing can certainly be helpful. Now, it's important to know which kind of tests are actually effective. And the last thing I want for you is to waste money on a test that won't give you the answers or gives you a long list of foods you have to avoid, and then you end up being overwhelmed. Now, if you've already done the test already, that's okay. Even if the test isn't particularly accurate, it can still give us information, and we can work with those suspected foods that have shown up as high on your test and see what we can do to bring those back into your diet. We can use those tests to validate whether or not you have a sensitivity, which we'll talk about later in this episode. So either way, if you haven't done the test or you've done the test, this episode is going to be helpful. Okay, let's do a quick allergy 101 to talk about the difference between IgG tests, which usually functional practitioners will often recommend, usually a naturopath. And then there's also the IgE test, which your physician could run the test for you. Now, Ig stands for immunoglobulins. It's a type of antibody that is produced by your immune system. And the purpose of antibodies that we all have in our bodies is if there is a perceived threat or if there is something in the environment that is a trigger, this is where the antibodies come up and they will respond to things that are exposed to. It's part of our immune system, and it's important to have antibodies because that's when we know how to fend off things. And the two most important antibodies, especially for food sensitivity testing, are IgE and IgG. So typically for IgE antibodies, these are the ones that are associated with immediate allergic reactions. So think of the people that have the classic food allergy, peanut allergies, nut allergies. When they eat the nuts, it's an anaphylactic reaction. It can be quite fatal. It's very dangerous. Other times it may not be as severe. It's severe enough where they experience swelling, itching, vomiting. They're quite significant reactions. These sort of reactions will happen fairly quickly, often occurring within a few minutes, sometimes maybe a couple hours later. IgE are your immediate food reactions. IgG antibodies are different. These antibodies are produced when you're exposed to foods. It's part of a normal immune response. Now, this is where it becomes controversial, and it still is to this day after many years. Most of these commercial food sensitivity tests that people get measures these IgG antibodies. When it shows up high on this test, they tell you that you have a sensitivity to this food, and that this food is the issue, which is why if some of you have done food sensitivity tests, you've probably seen the long list of foods that you have to avoid. And you probably are confused. I didn't know I had an allergy to something random like asparagus. I didn't know I have an allergy to broccoli. These are great vegetables and I eat them regularly in my diet. Why is it showing up high? And this is where the issue starts, because most allergy organizations, like the American Academy of Allergy and Asthma Immunology, they actually disagree with IgG food panel testing, as well as the Canadian Society of Allergy and Immunology. I actually went to their conference last year where they talked a lot about this kind of stuff and why they disagree with food IgG sensitivity testing. There is a lack of evidence that these tests are actually accurate, and they often are not. And they've mentioned on their websites and their resources their advice against testing. And here's why. Many of the researchers have studied this, and they believe that these IgG antibodies, when it shows up high on a food sensitivity test, it's actually showing an exposure to that food because you've been eating that food regularly in your diet rather than actual intolerance. So for example, if you're eating asparagus in your diet, if you're eating broccoli in your diet, and these IgG antibodies are showing high for these vegetables, then that makes sense, right? Your body's exposed to this food, your immune system is exposed to this food. That doesn't necessarily mean that food is an issue, especially if you don't have symptoms. Point is, we don't have strong enough evidence to show that high IgG levels from these tests mean that it's causing your eczema or causing your digestive symptoms. It's not as simple as that. And if it was the case, then we would see everyone's eczema start to improve when they avoid these foods, but we don't, right? People end up restricting their diet pretty severely because we know a lot of these tests are showing up high and everything. And so a lot of patients, eczema warriors, go on these diets hoping for their skin to heal, but it actually makes matters worse because they're restricting their diet to very minimal foods. Now they're experiencing nutrient deficiency, noticing a negative impact on their microbiome, which happens when you don't have enough variety. And it's also very inconsistent with these tests. Sometimes people will test positive for a food they eat every day. Other times, some people will not eat the food at all and it will still be high. And others will remove every food on this list and still have skin issues. So it's not very accurate, and it doesn't really tell us what is really going on. It doesn't tell us what situation applies to you. And then I also get the question of, okay, but Julia, when I avoid all these foods on the list, my eczema got better. And yes, certainly if you're avoiding a lot of the foods and you do find out that one of them might be a trigger for you, because yeah, with eczema, there are food triggers, maybe not to the extent of all the foods on the list, but maybe there's one or two, and you cut it out, then yeah, you're going to feel better. You're going to see improvements. That is definitely a valid reason. Now, at the same time, typically when people have done these food sensitivity tests, they've also started their healing journey where they're generally eating cleaner, they're eating less processed foods, they're having more fiber, vegetables, they're adopting a healthy diet. So how do we know if it's the food sensitivity test or it's just the fact that you've changed your lifestyle, you changed your diet? What I'm saying here is we don't want to use a test to base decisions on. Even as a root cause clinician, yeah, I love reviewing GI map. I think it's a very good tool, but I don't just treat the lab because that's not going to get you anywhere. I'm always asking my patients all of their symptoms. Are they sleeping? What supplements are they on? Their diet, their medical history. I really have to piece every part of the puzzle together in addition with the labs to understand the full clinical picture. We can't just use one test and assume that is the root cause because it never is. It's never just one thing. It's very cookie cutter with how eczema is still being treated nowadays, unfortunately. And that's why I've been doing this for so many years, and I'm still trying to educate and let people know that it's not just the cream. It's not just slathering on topical steroid. I had a patient this week, his dermatologist was like, you should go on a JAK inhibitor, Opzelura, and use that on your skin every single day. He used it. Of course, his skin completely cleared. But what are the side effects, right? There's always going to be side effects when it comes to medications, when it comes to even supplements. We have to consider a lot of factors when we're trying to address eczema. The other thing that's really important to note here is these food sensitivity tests have caused so much food anxiety in people. And I'm saying this because I've seen it with patients, clients that have come to me being given a protocol where they had to avoid 20 foods. And now 3, 4, 5, 6, 7 months later, they're so nervous and afraid about adding these these foods back because they were told that these foods were the issue. And now they're overwhelmed. Now they're stressed. Now they're scared to eat asparagus. They're scared to eat a piece of bread. We don't want that. That's really frustrating. If you're someone listening and you are on a restrictive diet, just know that there is hope. I've worked with a lot of patients over the years, and the ones that have been on strict diets, it takes some time to reintroduce foods, but it does work. And that is the gold standard, by the way, to determine whether someone has a food sensitivity or not. The gold standard is to trial removal of the food, then bring it back in strategically, ideally working with a registered dietitian who has experience and seeing how your body responds. This is what the allergy organizations recommend, and this is what they often do in office with their patients. And we can also do that as well as dietitians, help you bring back those foods that you used to avoid. A lot of the work that comes along with reintroducing foods is the stress around it, the anxiety, building confidence around your food, working on your immune system. Because if you're reacting to foods, that's a sign your immune system is overactive, and we can work on that through diet and lifestyle. There are ways to bring you back to baseline, bring you back to the point when you ate whatever you wanted. Maybe this was months ago or a few years ago. It just takes a personalized approach and a strategy to help you get there. So that's food sensitivity testing. If you are getting the test, I would say don't, and work closely with a dietitian. I can help you with that to figure out what your true sensitivities are without needing to do unnecessary testing. Now, IgE testing, that's the other antibody, is a little bit different. They're often used if someone is suspecting actual food allergy, peanuts, your nuts, your immediate reactions. However, there's also a nuance with that test as well. When someone has a positive IgE allergy test, it doesn't necessarily mean that you have a significant food allergy, which is why you've probably seen, if you've done the IgE test before, that something is showing up high, but you've ate it and you were fine. And what's interesting is with eczema, we know that it's an overactive condition, overactive immune system condition. Your body is already highly sensitive. And when you do the test, when you're inflamed and your immune system is overactive, things tend to show up as high. IgE tends to show up as high. And this is relevant because if you're doing the IgE test, you'll end up seeing more false positives. And hopefully your physician or your allergist explains that to you, because it is something that we see often when I'm looking at IgE levels. They're often through the roof for my patients with eczema, even more with TSW. And then they also notice their allergies to foods have increased too, because we know there's also a connection between eczema and food allergies, right? There's that atopic triad, eczema, allergies, and asthma. So people do have that combination. With the IgE test, while the test can be helpful, your allergist or your physician should be also looking at symptoms, your medical history. Maybe they even do a food challenge with you to see if you're actually reacting to the suspected food. And so what I do in my practice when I'm working with someone with eczema is I'm assessing their diet, looking at it in detail. There is a tracker that I often get my clients to fill out, especially if they have possibly food-related symptoms. And in that tracker, I look at whether or not they notice symptoms when they eat a certain food. If they do notice a symptom, when exactly? Is it a few minutes after, or is it a few hours, or a few days? Is there a pattern? Every time they eat this food, they get a reaction, or does it seem inconsistent? The other factors as well, I'm looking at their digestive system, their sleep, their nervous system, because those things can also impact how someone responds to their food. Takeaway for this episode is that there is a time and place for testing, of course, but we have to be careful and know what you're testing for and why. If you're relying on a food sensitivity test to give you an answer of what's causing your eczema, it's not going to do that. You may be missing the full picture. I think sometimes people forget that your answer actually lies in your day-to-day, your history, and your symptoms. Labs can be valuable information, but again, we're not treating the labs, right? We're looking at the person, the whole body, what's going on. And when you have an understanding of your body, your symptoms, your medical history, and you have blood work to support that, that's when we actually start to see healing happen and more of that progress. So if you need help with this and you need support with your diet, reintroductions, just generally how to navigate your diet in a way where it's non-restrictive, very healing. And if you have food sensitivities and allergies, this is something that we specialize in that we can help you with. We also help you look at the root causes and just help you figure out how to heal your skin, your gut. We also work on the nervous system as well. I will leave a link in the show notes below as always, and that's where you can apply. It's a short intake form to work together one-to-one, and then there's a free consultation call so that I can get to know you and see where I can support. If you like this episode, and if you know anyone else that has eczema, food sensitivities, or they're wondering about these tests, then make sure you send that to them and give this video a thumbs up if you're watching this on YouTube. Subscribe to the channel because we release weekly videos. Thank you so much for being here. I hope this was helpful, and we will see you in the next one. Bye.